Hello everyone, I am Dr. Jane Ricaforte-Campos, and today we're going to discuss prevention of transmission and reactivation of hepatitis B infection. We will tackle the mode of transmission, highlighting on the most common myth on how the virus is transmitted. We will talk about general measures in prevention of vertical and horizontal transmission, and we will talk about flares or reactivation, mention about conditions that predispose to flares and how can this be prevented. There are two principal ways of acquiring the hepatitis B virus. One is vertically, meaning mother to child during birth, and horizontally through different routes like between children, through cuts, shapes, bites and scratches, unprotected sexual contact, or via parenteral or percutaneous way through needle stick injuries, blood transfusion, hemodialysis, medical procedures, intravenous drug use, tattooing, ear piercing, and acupuncture. The most common misconception we encounter among lay people when it comes to transmission is that hepatitis B can be acquired through food, water, air, sharing of utensils, and casual contact. As a responsible physician, it is our moral duty to educate and emphasize to our patients that hepatitis B virus can only be acquired through blood and body secretions. One thing good about hepatitis B infection is that it's a preventable disease. Vertical transmission of hepatitis B virus can always be prevented through screening of all pregnant mothers during 28 to 34 weeks of age of gestation or even before intending to become pregnant. Hepatitis B vaccine is effective in preventing infection after a person is exposed to the virus by any means if given soon enough after exposure. Hence, the first dose should be given within the first 24 hours of birth to prevent establishment of the infection to which the newborn infant is already exposed. The protective efficacy of the hepatitis B vaccine in preventing mother-to-child transmission ranges from 80 to 95%. Since 1983, the Department of Health have incorporated hepatitis B vaccination in the expanded program of immunization. Hence, everyone born during that year onwards should have received 3 doses of the vaccine at least before the age of 2. For those who have missed availment of the program, particularly for those home-delivered and living in far-flung areas, a catch-up immunization can always be acquired, preferably before the age of 5. We have to bear in mind that children have a 90% chance of becoming chronic carriers if infected at the time of birth, 30% chance of becoming chronic carriers if infected between 1 and 5 years of age, and 5 to 10% chance of becoming chronic carriers if infected after 5 years of age. Horizontal transmission, on the other hand, can be best prevented through safe practices in terms of lifestyle, for example, practicing safe sex through the use of condom, personalized manicuring set, and bringing own set of needle and ink if contemplating a body tattoo. Mandatory screening of blood and blood products in all hospital institutions and imposing proper infection control measures were found effective measures to lessen the burden of the disease. Now, let's deviate a bit and talk about hepatitis B flare or reactivation. Chronic hepatitis B is a dynamic state of interactions among hepatitis B virus, the hepatocytes, and the immune cells of the host. Hepatitis activity can occur spontaneously, resulting to conditions we term flare, acute exacerbation, or reactivation. By definition, it is an event where you see a sudden or abrupt rise in ALT levels to as high as 5 times the upper limit of normal during the course of monitoring of a chronic hepatitis B carrier. This phenomenon is due to a human leukocyte antigen 1 restricted cytotoxic lymphocyte-mediated immune response against the hepatitis B virus and its downstream mechanisms. In a hospital-based study of chronic hepatitis B, the annual incidence of hepatitis flares was calculated to be 27% in 358 E-positive patients and 10% in 279 E-negative counterparts during a mean follow-up period of 2 years. You must remember, though, that multiple episodic hepatitis B flares can happen in one individual patient. So what conditions predispose to a flare? Flares are frequently induced by medical treatments such as cancer chemotherapy, anti-rejection drugs used in organ transplantation, and corticosteroids. However, flares are not uncommon during and after withdrawal of antiviral therapy in patients with chronic hepatitis B with or without cirrhosis. The interpretation of a flare will depend on whether you are dealing with a cirrhotic or non-cirrhotic patient. For cirrhotic patients, an upsurge of serum HBV-DNA and HBs surface antigen levels usually precedes the abrupt rise of ALT levels. Rising or stable and high HBV-DNA during flares represent ineffective immune clearance and further hepatocytolysis resulting to hepatic decompensation or failure. Hence, immediate antiviral therapy is recommended. In contrast, flares in non-cirrhotic patients with decreasing HBV-DNA may be followed by HBV and or HBe antigen loss with remission, and therefore may be observed for 3 to 6 months for real indication of antiviral therapy. We can always prevent flares through screening, monitoring, and prophylactic or preemptive antiviral therapy among patients who are going to receive immunosuppressants or chemotherapy. Antiviral therapy initiated concurrently or prior to immunosuppressive therapy can decrease the risk of HBV reactivation. Entecavir and tenofovir are recommended over lamivudine because of their low resistant rates and more likely to result in viral suppression. The duration of therapy will depend on the type of immunosuppressive therapy, the patient's baseline HBV-DNA level, and the degree of underlying liver disease. In general, antiviral treatment should continue for 6 months after completion of immunosuppressive therapy or until endpoints for chronic hepatitis B infection in immunocompetent patients have been reached. We have discussed briefly the prevention of hepatitis B infection as well as prevention of reactivation and flares in a patient with chronic hepatitis B infection. For further knowledge about this topic, you may always download for free the following articles: the AASLD Guideline for Treatment of Chronic Hepatitis B, the EASL Guideline on Hepatitis B Flares in Chronic Hepatitis B, as well as Preventing Mother-to-Child Transmission provided by the World Health Organization. Thank you very much and have a nice day.